Good evening and thanks for joining us. There is relief on the way if you have been laid off or cannot work because of COVID-19. We have some important details tonight about the federal legislation passed in Parliament overnight. It's called the Canada Emergency Response Benefit, and it will inject billions into the economy. That includes $2,000 per month for the next 4 months for workers affected by COVID-19. This virus has killed business, and this emergency aid package, totaling $107 billion, is designed to help individuals and businesses by delivering direct support and tax deferrals.
We are working in order to make sure that we have the capacity to protect Canadians, to get ourselves through this, and to come out of this challenge. This is, we expect, a very challenging time, but a temporary time, to come out of this challenge with our economy intact.
We know many Canadians need the money now with rent and bills to pay, but the checks aren't going out tomorrow. Michael Couteur has more on what the government is saying about the timeline.
Help is on the way.
The government is trying to reassure Canadians who have already missed a paycheck because of the COVID-19 outbreak, releasing the details of the aid package and exactly who it will help.
Whether you're full-time, contract, or self-employed, this new benefit will be there for you. If you're sick or quarantined, looking after someone sick, or at home taking care of your kids, it's there for you.
The Canada Emergency Response Benefit also applies to people who have yet to be laid off but aren't getting any income because of this crisis. Now, it covers a lot of people who need money now, and that's the biggest problem. Now, the government online portal to apply for these benefits is scheduled to be up and running by April 6th, and the Prime Minister has promised money in your pockets within 10 days of applying for it, meaning financial help is still 3 weeks away. Questioned about that delay in a special Senate session, Finance Minister Bill Morneau explained they're doing the best they can.
There aren't faster ways to get money in Canadians' hands. That is, in fact, the challenge that we're facing in this particular situation.
1.1 million Canadians have filed for employment insurance since last week, and that number is expected to grow. The Prime Minister says 1,300 civil servants have been brought in to help process all those claims. And to prevent more claims, business groups say the government could have used companies to funnel the money to Canadians and avoid more layoffs.
We can avoid that by executing expeditiously with a greater sense of urgency and working collaboratively together with business so that we can keep these employees on a payroll and not have to have them go through an arduous EI process, if at all possible.
The Finance Minister admits the systems that will deliver these government services were not built for the type of stress and strain they are about to endure. And that's why the government feels it was so important for Parliament to sit through the night so Canadians can get the benefits as soon as possible. Donna?
Michael Couture in Ottawa, thank you. Here's how many people are diagnosed with COVID-19 in Canada right now. There are more than 3,300 confirmed cases across the country. More than 30 people have died, and the spread of the virus is accelerating. So far today, at least 610 new cases have been reported. Ontario had its biggest daily jump yet, 100 new cases, and that brings the total number in that province to 688. 17 of those people are in intensive care. In Newfoundland and Labrador, the number of cases nearly doubled today. 67 people now have tested positive. 44 of them have been linked to a funeral home in St. John's. It's believed someone with COVID-19 went to the funeral home last week, exposing others to the virus. People across Newfoundland and Labrador are being urged to stay home.
The safe thing for you to do now is assume that there's COVID around you and to stay home and stay apart, but stay connected.
A Canadian member of Parliament has COVID-19. Kamal Khera is the first MP to test positive. She is a two-term Liberal MP from Brampton West, Ontario, and a registered nurse. She tweeted she's experiencing symptoms but is in good spirits. As our chief political correspondent, David Akin, reports, what's concerning is who she's been in contact with over the last 2 weeks.
It was March 11th when Brampton West MP Kamal Khera met the executive director of the United Nations World Food Programme, David Beasley, at a Parliament Hill reception. Then, 8 days later, on March 19th, Beasley said he had tested positive for COVID-19 and had been in quarantine for 5 days. That meant Beasley would have been in self-quarantine on March 14th, 3 days after the reception in Ottawa. But on March 17th, Khera announced that as a registered nurse, she was volunteering to be on the front line to fight the virus in Brampton. It's not known if Khera did any frontline nursing work then or after Beasley announced his positive test, and she did not respond to inquiries from Global News. Beasley also met with as many as 50 MPs during his official visit to Canada. Some of those MPs have been in self-isolation ever since, though Khera is the only MP so far to have been confirmed positive for COVID-19.
And all of this, of course, underlines the risk politicians face and the risk politicians represent because, of course, politics is a social business. And it, like so many other businesses, is now undergoing rapid change. Donna?
All right, David Akin in Ottawa, thank you. Jeff will continue to consult with experts and try to answer your questions. Send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.